matter who you are, we're all different, we're all made different. So it doesn't matter whether you've got a colostomy, an ileostomy or a urostomy, it's unique to you. There are generalities. You can say that a urostomy passes urine and it's normally got what we call a spout on it. An ileostomy should be much like a urostomy but with a spout, so that you've got a good functioning piece of bowel to go into the bag so that you're not getting leaks underneath.
Not all stomas are the same,
No.
So does that also mean that not all ostomy bags are the same? There are lots
No.
of different types of ostomy bag.
I've always said that I wouldn't be able to choose an ostomy bag for you because I wouldn't choose a pair of shoes for you. That's the sort of thing that we have to think about. Everybody's different, everybody's lifestyle is different, but there are certain types of ostomy bags that suit the type of stoma that you've got.
Okay.
So if you have got a urostomy, then you would need a bag that's got a tap. Because you're passing urine, you would need a bag that would collect the urine in because it's going to be water. If it's an ileostomy, you would need what we call a drainable bag. And that's a bag that's got the outlet at the bottom that you can unfasten, empty into the toilet, and hopefully then those two bags I've spoken about can stay on the abdomen for 3 to 4 days. The colostomy appliance is what we would call a closed bag, where the bag is taken off and then you put a clean bag on every day if that's what you want to do, dependent on what your output is really. And this could either be a one-piece or a two-piece appliance, and so can the other appliances as well, dependent on your lifestyle.
One of the biggest fears for ostomates is having a leak. Is there a particular reason why bags may leak, and are there ways to avoid leaks?
I think over the 15 years I don't think there's any ostomate that's got away without a leak, and I think that's purely because when a patient first has their stoma formed, you may have lost some weight and you may have been quite ill before your surgery in some cases. And when we first show patients an appliance and they choose an appliance, we talk to the patient about how the appliance works, how to apply it, about cutting it to the right size. Once you've gone home and you're feeling well, you start doing your own stoma care, and sometimes patients often get a little bit, well, I can do this, I'll get this on and off and we'll get on and do what we need to do. And sometimes it's because you've not took a little bit of time doing your stoma care. If you start putting a little bit more weight on, and that's for a good reason because you're starting feeling well again, then sometimes patients don't often check the size of the template. So if the template size has changed and the patient is putting weight on, then things your stoma becomes a little bit bigger and you might need to cut your bag a little bit bigger. In some cases you might need to cut it smaller because if the bag doesn't fit well, then you will get leaks. The stoma also changes and it does reduce in size. So if you have got a good spout initially, it sometimes does reduce in size after your surgery because the bowel has settled down because it's been handled during surgery, so it does tend to swell up when you've just had your surgery done. So it's important to keep checking the size of the stoma and checking that the skin is not too exposed, but you're not putting it too big or too small. It may be that the bag doesn't fit into the contours of your body as your body changes. Leaks are something that nearly every ostomist may have had, some more than others, and it depends on the type of stoma you've got. If the stoma has been formed really well by the surgeon, then often there's not many problems, but it just depends on how that stoma has been formed.
Another big fear that people have is that fear of having a blockage. So again, is there anything that can be done to avoid having a blockage?
Part of our job is to explain the function of the bowel, and if a patient is particularly going to have an ileostomy, then it's really important to emphasise about the foods that can block the ileostomy. And there are lots of foods that can do that. It's instructing the patient on foods to try and not avoid, but to chew the food really well, to drink plenty of water, and to be aware of the foods that can block the bowel, like peanuts, sweet corn, fruits with skins on and vegetables with skins on. So really it's just being aware of what you're eating, and if you're worried about the bowel blocking, then it's really important to ring us as soon as you feel bloated, that you've not functioned from your stoma for a few days, that you're feeling really unwell.
Yeah.
When you first go home, once you've had a stoma formed, whether it's a colostomy or an ileostomy, we tend to tell a lot of patients to try and stick to quite a bland diet initially, just to give the bowel time to recover from quite a traumatic time being handled and having a stoma formed. And then when things start settling down, try and introduce small amounts of vegetable and then increase it as you're feeling a little bit better.
If someone did have a blockage, what's the best thing to do? Obviously contact the stoma nurse. Is there anything they can do at home in the meantime, or?
Probably to stay off food, stay off the food,
Yeah.
drink plenty of water, and just try and avoid any food for about 24 hours and just see if things settle down. If you give yourself 24 hours, 48 hours without any solid food and just have soups or things like that, things may settle down.
Okay.
But obviously if you do feel really ill and you feel really sick, then you must contact your doctor.
Well, we've come to the end of today's video. Thank you, James, so much for answering the questions. And if you have any questions that you want me to ask James, feel free to put them in the comments below, or you can tweet